I can remember when I was in training, which was pretty much like from 93 to pretty much 2001. And diabetes at that time was at the point where we started just to get to know the effects of diabetes, not only on other organs of the body, but especially the feet. The two components of diabetes that affects major portions of the body, like the feet and the eyes, is usually some type of circulatory problem and some problem dealing with the nerves. So you're talking about either poor circulation and a condition known as neuropathy, where people can even feel or have sensation in their lower extremities. So for example, if they get a cut on their foot, if they have poor circulation, they may not heal. If they get a cut on their foot and they can't feel it, there's a possibility that they may not even recognize that it's there, especially if it's on the bottom. And so therefore, poor circulation and ability to feel definitely would make it worse. And so the thing about it is, what I always encourage our patients to do is that you definitely have to have a good rapport and a relationship with your primary care doctor. You have to go to your doctor on a regular basis so that if you are diagnosed as a diabetic, you definitely need to be seen by a podiatrist on a regular basis. We think about every 3 to 4 months, and that you definitely need to see an ophthalmologist at least once a year. So the thing about it definitely starts with education. It definitely starts with awareness and making sure that you see a podiatrist or a specialist as soon as possible. Don't wait till the last minute, because a lot of times I hear so many patients state that, oh, I had an injury to my foot, but I waited. I thought it was going to go away. And so one of the things I try to advocate for is, if you have an injury, if you drop something on your foot, you hit it, that is a traumatic episode that has happened to your part of the body. Don't take for granted that it happened to your foot, because a lot of times we need our feet to walk. We need our feet to drive. And we definitely need our feet to do our daily activities, and especially do your job. Without a limb, the possibility of being able to work is paramount. And so if you can't work, that means you can't have an ability to earn an income. That means you no longer become a productive citizen of society. And that leads into depression. That leads into loneliness. And as the Surgeon General just stated maybe about 8 months ago, loneliness and depression is an epidemic too. So many things kind of interrelate with one another, and we need to be able to make sure that primary care doctors refer to the various specialists. So if a patient is newly diagnosed as a diabetic, make sure they at least get their foot exam.